Hello, this presentation is brought to you by Maria Borges from Keiser University Sports Medicine and Fitness Technology Bachelor's Program. The class course is Special Populations, SPM 4157. The purpose of this video is to give a brief summary of Maria's client and how she assessed her during the course of the weeks. My client is 41 years old and has been living a sedentary lifestyle for quite some time. She does administration work at a university. She has a sit-behind-desk job. She answered no on all her PAR-Q questions, so she is ready for activity. She has no heart or lung problems that will hinder abilities to engage in physical activity. Her family has a history of cancer. She does admit to having poor eating habits. Jessica tends to have a sensation of eating sweets, and she eats out more than eating cooked meals at home. When it comes to exercising, Jessica is not a real self-motivator. While assessing her through these weeks, I will try to give her a little motivation so that she will be able to build her self-motivation up so that she will engage into exercising without relapse. She has a short history of prehypertension and the only medication she is on is birth control. My client is One quick tool I used is the body mass index for Jessica. The first time I seen her, I wanted to get her body weight and height so I can at least get a general idea of what her body type is comparing her height to her weight. Her results came out to 42.48, which is in the morbid obese, class 3, category. I need to take this reading in consideration because the higher her BMI is, the more it will affect a person's health. The BMI doesn't determine if you are fat or how much body fat someone has, it is just a general guideline used in society. To try and get Jessica's VO2, at first I attempted to have her perform a step test, but it was not suitable for her. So I had her perform a 1-mile walk test. It will be easier and more convenient for her to complete than the step test. With her VO2 results, I need her to improve her cardiorespiratory fitness. I would take note of that upon creating her training program. After the test, her VO2 came out to 24.39. Her VO2 max is low and needs improvement. She does engage in physical activity sporadically during the weeks, but not enough to gain the benefits of cardiorespiratory fitness. For the first week, I am going to have her start off with light exercises. In her first week for cardio, just 30 minutes at an intensity level of 50% of her maximum heart rate will be good for her. I will have her do that for 3 times a week so she can get his body ready for intense training for the rest of the whole program. Every week I am going to keep the same intensity level, just increase the duration for 10 minutes. When she is able to do an intensity level for 60 minutes max, then I will increase the intensity level and bring back the time from 60 minutes, back to 30 minutes at that new intensity. When she has reached to an intensity level between 70 to 80%, I will have to fluctuate the time for her so it won't be way too intense for her.